Okay, great.
And we have no attendees yet. They're filing in. Okay, they're starting to come in.
Okay, great.
Give it a second.
Hi, my name is Ann Darling. I work with the Office of Behavioral Health. It's my understanding that we're having attendees coming into the system right now. So we're going to go ahead and give it just a moment longer to allow individuals to filter in prior to me starting with my moderator notes and with the introduction of our presenter today. Okay, sounds good. So thank you for attending the 2020 Behavioral Health Symposium. We are happy to host this event as a virtual conference because we care about your health and your safety. We also understand the importance it is to provide relevant and robust continuing education for Louisiana healthcare professionals. For quality purposes, all participants will be muted during the presentation. If you would like to submit a question to the speaker, please utilize the question and answer feature in the virtual platform. Accreditation. This session is accredited for 1.25 hours for the following professionals. Social workers, it's general credit. Licensed professional counselors, peer support specialists, nursing contact hours, and AMA PRA Category 1 credits. Full participation is required in order to receive credit. This will be monitored throughout the session. You'll receive an email from Women's Foundation with detailed instructions on how to claim your credits and access your certificates. Additional information is available in the digital event booklet. Financial disclosures. George Mills has no financial disclosures. None of the members of the symposium's planning committee or any session moderators have any financial disclosures. So let me introduce George Mills. He's the presenter today. George is the executive director of the Extra Mile in Region 4. He provides leadership, oversight, and strategic vision for the organization. Essential services include multiple in-home family preservation, prevention, intervention, and treatment services, a recovery and resource center for persons with severe and persistent mental illness, and peer support specialist training in the state of Louisiana for OBH. George has served in executive leadership roles for behavioral health service providers for over 25 years. George has a BS in Human Service Administration from Franciscan Missionaries and Our Lady University. George has worked with us for a while, and I'm going to go a little bit off script, but George has worked with us for a while within the Office of Behavioral Health because we do work with them, and he helps us implement the peer support specialist trainings that we have operated through our office. And we really appreciate George's leadership and his guidance in this initiative and others that he operates with in conjunction with the Extra Mile in Region 4. Thank you so much, George, and I'll let him get started. Thank you.
Well, good morning, everyone. This is a little unusual for me because this is actually my first virtual presentation. I'm used to having live people in front of me, but I very much appreciate being able to do this. And I wanted to especially echo something with the Office of Behavioral Health, because I really, really appreciate their commitment to peer support and peer support specialists. They have done a tremendous amount of work behind the scenes in getting ready for some of the stuff we're going to talk about in this presentation. Just for a little, and Ann was very gracious, as you said, I've been around for a long time and provided leadership in multiple levels of care, everything from addiction treatment services to working with human trafficking victims. And the reason I wanted to say that really is because I'm very familiar and have been very involved with the use of peers in those different processes, and with the different clinical teams I've had, and medical teams I've had the opportunity to work for. And peer support is many times an underutilized resource, and sometimes a misunderstood resource that we have accessible to us. In thinking and getting ready for this presentation, I drove by Ruth Chris Steakhouse on the way over here and realized that, when you go in there to have a dinner, everyone typically has a steak and a baked potato and a salad, but peer support services in relation to clinical services can be deemed as, that side of asparagus or that cheesecake for dessert. Is a complementary piece that really helps the clients that we serve in that. So what I'm going to do is kind of start into this a little bit. And we're going to do, and again, Ann's already said the financial disclosure. I was asked to do this too because our agency does contract with the Office of Behavioral Health to provide the trainings. We also have a couple contracts with the Acadiana Human Services District. So that would be the complete disclosure of the relationships that I and my organization have. Let's kind of dig into peer support. Again, I don't know totally the audience that is attending this. I can assume that some of them are interested in peer support and how their agencies can utilize peer support. Others, maybe this was the most interesting of the sessions available at this time, or the others that want to know because there is knowledge that peer support is going to be a Medicaid reimbursable service. So we're going to talk about that. So hopefully when we finish this session, we'll have a little bit of fun. And we'll also learn, how we can better utilize peer support, what's next, what's happening with things. And we're also going to hear from a peer support specialist that we're going to bring up to kind of give a personal take on peer support and peer support training. But first of all, just a couple definitions. A peer support specialist is a person in recovery from a behavioral health condition, mental health, substance use or co-occurring. And let me stress that again, it is a person with a lived experience. To become a peer support specialist, you have to have a lived experience. Peer support specialists provide mentoring, guidance, support, services, working in conjunction with the clinical treatment providers. And again, peer support and the clinical team are a partnership. And the whole goal and the reason for that is to enhance the treatment and the recovery process for the clients and individuals that we serve. They use their skills to others experience behavioral health challenges and receiving behavioral health services. Find my button. Okay, peer support specialists. Peer support specialists can and should assist in the following areas: identifying goals, assisting with treatment planning, life skills coaching, resource referral, conducting recovery groups, and assisting with discharge planning. Now we have to be careful here to realize that a peer support specialist, even though they're certified through the training we're going to talk about a little later, they are not a replacement or a substitute for a quality clinical or medical treatment team or a medical team. They are an assisting, a complementary piece, and can be used very effectively in that treatment process. In saying that, some of the things that peer support specialists cannot provide or cannot do is they can't provide therapy. Of course, they can't do medication management. They can't do psychosocial evaluations. They can't do any kind of diagnostic assessments. They can't provide any kind of psychiatric services or psychiatry services. And they can't conduct any kind of therapy groups or process groups in the scope of service delivery. Wanted to read this, peer support specialist. The journey of becoming a peer support specialist leads to knowing how to take all of your experiences, regardless of the pain and use them to transform your life into what we call living hope for others who want recovery. Now, that comes from the RI International Peer Employment Training curriculum that we use in training the peer support specialists and the advanced peer support specialist trainers that we utilize in the state of Louisiana. Currently, in the state, to become a peer support specialist, you have to go through an application process and be accepted into the current training. Now, I want to emphasize when I talk about this training is this is the only approved training by the Office of Addictive Disorders for peer support certification. Now, there are other trainings out there, others that are recognized in different states, but to actually work as a peer support specialist within the state of Louisiana, and when we get to Medicaid reimbursement, this is the certification that they have to have. So again, if you're an administrator, if you're someone seeking to become a peer support specialist, this is your only vehicle presently to become certified to provide peer support specialist services within the state of Louisiana. And this has been established statewide, and the curriculum is from RI International. Now, there is a reciprocity process if someone has completed the RI International trainings in another state, but again, it has to be the RI International trainings. The training itself is a 2-week training. It's 5 days a week for 2 weeks, 76-hour training. Some of the components of that training include role play. There's a written midterm. There's written and practical final exams. Upon successful completion, peers receive a certificate of completion. Now, this is a very, very comprehensive training. We have great trainers that do this. There are daily homework assignments. There is a lot of interaction. It is not a training that they can just kind of go to and hang out during the training. They fully participate in the training. They interact in the training. And the feedback, and you'll hear from a trainer later on, it is a very comprehensive and a great training for them. The training structure currently and before Louisiana, up until COVID, trainings were being offered 4 times a year in rotated geographic locations. We were training approximately 20 to 24 individuals per training. Those trainings were held typically in either hotels or in conference rooms. And that allowed for us to be able to train 60 to 80 peer support specialists per year. With COVID, that literally changed everything up that we do. We were able to take those trainings and utilize Zoom as a format to do them, which we are currently doing. We're in the middle of our 3rd training, online training when the hurricanes came. So we've actually completed 2.5 online trainings, and we'll resume and complete the other one going forward, hopefully within the next couple weeks. Those online trainings to maintain the fidelity of the model, and then we're able to serve 10 to 12 participants per training. So the amount per training has decreased, but the good thing about it is we're doing those trainings monthly now. So it makes it available to actually provide 120 to 140 individuals the training during the course of the year. Now, there is schedules posted for those trainings. Those schedules are flexible because of the different circumstances and the things going on between COVID and hurricanes and other things. So those application deadlines and the trainings are flexible. They're going to remain flexible. It is our hope, again, to eventually get back to not only the on-site trainings, but the virtual trainings, and hopefully get those rolling as, COVID and this, we're allowed to do so. Okay. The Office of Behavioral Health started their peer support training program back in 2008. And so far to this date, there have been 620 individuals trained as peer support specialists. Currently, there's 357 active peer support specialists in the state of Louisiana. The Office of Behavioral Health conducted a survey this past December, and through the respondents, it was determined that 73% of those active peer support specialists are currently working employed as peer support specialists throughout the state. So that's a good number. Application process. I touched on that earlier and wanted to dig into that a little bit deeper with y'all so you understand this process. There is an application process. The application is on the OBH website. At the end of the presentation, there'll be some information where you can request that application to get out. We have established deadlines for submitting the application. And before applicants were able to submit for their desired location, now since it's on Zoom, we're just trying to get them into the next appropriate training. Certain qualifying things is in the application process. They have to be at least 18 years of age. They have to have at least a high school diploma. They also have to have a year in recovery. So let's chase that for a second. A year in recovery, again, if it's a mental health diagnosis, that they're medication compliant, that they're going to their therapy sessions, that they're going to their doctors, that they're doing those things necessary to maintain a healthy recovery environment. For addiction, that they haven't had relapses, that they're sober, and that they're adhering to those recovery principles. The applications are written applications, and they are evaluated by committee, by a team that includes myself, an individual from OBH, and also one of our peer support trainers is on every committee. So you have multiple eyes and multiple individuals evaluating these applications as they come in. The applications are graded and evaluated based on the following 7 areas, which first of all is their understanding of peer support and how they perceive peer support coming into the training. Personal responsibility, how they take personal responsibility in their lives, how they take personal responsibility with other people, and how they define that. Community activity, how they're reacting in the community, what they're doing to serve in the community, what activities are they involved in. Excuse me. Literacy, how well we can understand their application, how well it's written, and how well their responses are to the questions that are asked. Another big thing that we look at is their employability. Will they be, after they have this training, be able to obtain employment and be employed in the capacity of a peer support specialist? Also, we look at is their support system. What kind of support system do they have in place? Who do they have around them? How are they utilizing that? Because again, we want to ensure that they're not only successful, but successful going forward. And then recovery maintenance, what they're doing to maintain their recovery, how they're doing it to make sure that they continue to grow, to improve, and that, because these things are all very important factors, especially with their interaction once they become a peer support specialist with the clients or the individuals that they come in contact with. Each of these areas, there's a rubrics that we use. There's 5 points per category. So there's a maximum score per application of approximately 35 points. There is a minimum threshold that has to be hit to be able to be accepted in the program, along with those other qualifying factors that I mentioned a minute ago. Once you become a peer support specialist, there's a continuing education requirement that requires that there's a minimum of 10 educational units done each year to maintain your active status. 3 of those units have to be done in the area of ethics, and the other 7 units are to be done, it must be done in competencies related to the tenets of peer support. Now, again, I wanted to say this too, because I've noticed as we get, as we're getting more inquiries about peer support and we're getting closer to Medicaid reimbursement, I've also been noticing some things popping up online that say that, you know, if you take this training, you can submit to OBH and they should possibly, you know, approve those CEUs. Well, that's not the case. Just like with this conference, CEUs need to be submitted beforehand. So again, if you're seeking any training for that or continuing education, make sure that one is currently done with the RI international training, and 2, that on your CEUs, that they are CEUs approved by the Office of Behavioral Health, because those are the ones that you will be given credit for, and those are the ones that you need to maintain to keep your certification active. CEUs are currently monitored by the Peer Services and Consumer Affairs Coordinator, and they're due every year by December 31st that they need to be turned in to be given credit for and to remain active. Peer support is relationship is the foundation of peer support. The more authentic that relationship is, the more powerful our ability to grow and heal together will be. Peer support is relationship, and I can't emphasize that enough. And let me kind of step back real quick. And you know, again, I first entered a recovery or treatment 46 years ago. I'm kind of giving my age out. And my first opportunity for that didn't work out real well. Because there was no engagement, there was not trust. I was young. So 5 years later, I was given the opportunity again for another thing. And at that point, when I came in, I met someone that had been in recovery, had been in the program. They said, this is a great place. The people care about you. The information is confidential. And there was an immediate, quote, click relationship developed. And it made a tremendous amount of difference in that initial skepticism, distrust, and different things. So again, I can't emphasize how much peer support helps with that engagement relationship. I'm really happy now that I'm about to bring up one of our peer support trainers, peer support specialists. Brent is an employee of the Office of Behavioral Health, and I believe he's actually peer support services for the Office of Behavioral Health. We're real glad that Brent was able to join us at very short notice. And Brent's a great trainer. I've had the opportunity to sit in on some of his trainings. I've actually got the opportunity to know him a little bit. And great guy, great trainer. And he's going to give you kind of a personal insight into work of peer support specialists and the training. So with that, I'm going to turn it over to Brent for a few minutes and would like you to welcome him. Brent?
Good morning, everybody. As George said, my name is Brent, actually Brent Ombacher. I am the State Peer Support Specialist with the Office of Behavioral Health. Actually, this month marks my 5th anniversary as a peer support specialist. I attended the OBH peer employment training in September of 2015. George asked me to talk a little bit about what it means to be a peer and what the nuts and bolts look like when we get out there. Yeah, as George said, I am apparently either asparagus or cheesecake. I'm not sure which one of those I am in the course of the menu, but I like both of them, so that's all right. We are an important part of a continuum of care. And I want to stress that we're an addition to the continuum of care for a clinical team. We're not a replacement for any piece. We're a glue that sort of flows around as needed between the different elements of a clinical team. My personal background, I'm eminently qualified to be a peer. I have lived with mental health challenges and substance use challenges since I was about 17 years old. George may have entered recovery when he was 46 years ago. I was 46 by the time I finally managed to get myself into a position where I was willing to actively seek recovery. For me, what that looks like is I stay on top of my mental health challenges. I use medication. I have regular talking therapy. For my substance use, I chose a 12-step pathway. I'm actively engaged in my 12-step group. And for me, that was a really valuable and worthwhile way to approach things. And I say for me, because one of the things that I've learned about being a peer is that just as we all have slightly different backgrounds and causes for coming to a point of recovery, we all also will have a different pathway out. And it's important for a peer to remain neutral in the sense that I am not here to specify which way you recover. I am simply here to help you navigate that process, to discover the journey and the pathway to recovery that is going to work best for you in conjunction with the other professionals that I serve alongside. So I think that's the real role that makes a peer stand out. George said life was very different. My first experience with the sharp end of mental health services was in the mid-1980s. I was on a full academic scholarship to an excellent college in Connecticut. Things on the surface seemed to be going well, but I was really struggling with depression and anxiety, and it was overwhelming. I thought I was going to ask for help. I went into a little clinic where I was living, started speaking with some people there. My girlfriend was waiting in the car outside, and before I knew it, I had been committed for 72 hours. This was not what I required, and it was certainly not what I was expecting, and I didn't feel heard. I did not feel helped. It is entirely possible that I may have busted loose from that joint without permission. This is the kind of thing that has improved immeasurably. All aspects of mental health and substance use services have gotten a great deal better. We're much better at hearing the people that come to us for help. And peers are an important piece of that. Like George mentioned, some of the other things we can do are also tremendously useful. When someone is seeking recovery, you often have a very small window of time within which to act. And it's vital that we have already built a relationship so that if someone says, today's the day, I need to get treatment for my substance use issues, we're able to connect them with the resources that are going to meet those needs. Peer support relationship between ourselves and the people we serve is based entirely on mutuality. I can speak to you in a different way from other members of your clinical team because I have been in a similar position. My exact experience might not be the same, but I know the feelings that go along with the experiences you're going through. You know, I don't tell people I know just what you're going through because of course I don't, but I remember what it felt like to live with hope. I remember what it felt like to feel powerless, totally confused, and have no ability to make a good choice for myself. Because we're able to build a relationship based on trust And based on the knowledge that we understand each other, it allows for a level of connection that lets them feel perhaps freer to speak with us than they might to other members of the team. And because, of course, we don't provide therapy and we're not medical in any sense of the word, we're not prescriptive in our discussions with them. I'm not telling you what to do. I am inviting you forward to help you find out what is going to be the right choice for you in this particular situation. It's really valuable to me to sit back and listen and learn what it is that works, because I get almost as much from the people I'm working with, certainly as much as they get from me. Every time I meet with a new individual, I've learned a new method and a new approach towards accessing recovery. We can help them do all manner of things. They need transport often to get back and forth to their sessions. They might need childcare. They might need access to employment training. You know, there's all kinds of other areas that go into recovery beyond putting down a substance or addressing mental health concerns. So these little add-ons are not little when you're facing the problem yourself. Really what the job of a peer is to provide options, explore the options with the people we're with, and help them develop a sense of self-advocacy. I want people to remember who they are and to use that knowledge to become what they have inside them, to reach the possibilities that have always been present, but they haven't been able to access. I like to think of my job as I'm here to work myself out of a job. I want you to not need me anymore. I'm going to be here as long as you are interested in engaging with me. And I'm still in touch with some of the first people I had the privilege of working with 5 years ago. And they'll check in with me just to see how, you know, things are going. And that's a really tremendous gift. So what does it look like in practice right now in Louisiana? Like I said, I've been a peer for 5 years. I've worked in a treatment facility. I've worked at the Office of Behavioral Health. My role at OBH is helping to mentor and oversee the work of peers throughout the state, working on a couple of opioid grants. So I've had the opportunity to watch peers in action in a variety of settings. Currently, we have peers serving in the correctional facilities. There's a really exciting pilot program that we've been running for a couple of years, working with people with opioid use disorder. It's showing great results. Going forward, we'd love to see more robust involvement with reentry. That's really starting to kick in. Peers work in treatment facilities for both substance use and mental health. They're in drop-in centers. They're at all of the local governing entities around the state. All of the human services districts have peers in a variety of roles. They work on harm reduction teams. And one of the things I'm most excited about, next month, we will be launching peers in 6 ERs as part of a pilot to help address people who have survived an overdose. We know from research that that is a tremendously effective tool in reducing relapse and return to use. And so we've piloted that in one LGE, and we're hoping to roll that out throughout the state as this goes on. So what barriers still remain? There are a few. Largely they're educational. There's still some misunderstanding of our role. Sometimes we're used more as greeters and people who are there to help you assist with paperwork, and we can do a lot more than that. But that's a simple question of getting the message out about what peers have to offer, and we're doing better and better with that. And funding can be a challenge, particularly for small agencies, figuring out how to afford a peer when not everything is billable. But again, that is in process right now. George will discuss that a little further in a moment. And we do occasionally face barriers around stigma. Sometimes people are a little leery about hiring someone with a mental health condition. One of our big challenges is we often have excellent people who come through our training and then struggle to find employment because of past convictions. That's really unfortunate because, frankly, I can't think of a better person to help divert young people away from, the possibility of ending up incarcerated than someone who has spent time inside the system. That, again, that barrier is starting to come down. We do have some of our peers working in drug courts, working to help reduce reoffending among young offenders, and that's a tremendously valuable role. I have real hope and enthusiasm for the direction that peer support is starting to take in Louisiana. We've got some very exciting things coming down the pipeline. I think we're going to have the ability to increase training in a variety of areas as well as our basic peer employment training. But I would really encourage you to reach out and ask questions if you want to find out more. It's been the biggest privilege of my life to serve as a peer. And I know from personal experience, both on the receiving end and as someone who is practicing the profession, it can make a life-changing difference. So with that, I will turn it back over to George. Thank you very much.
Thank you, Brent. And again, before we move on, I just wanted to echo on a couple of things he said. Is peer support throughout the state right now, as Brent said, we're kind of all over the board in roles and duties. At times, there's some differences too in what compensation for them across the board. Pretty wide range of compensation throughout the state. And moving forward, the hope is to really tie that all in. Peer support can be very, very effective. It can really help the clients that we serve. And really at the end of the day, at least the way I look at it, the organizations that I've been involved with, the organization I work with, does not exist to give me a job or to give my employees a job. That organization exists to help people. And that at the end of the day is our commitment to help the people that we serve and to impact their lives and their lives to be better. Peer support is an important component of that. We're going to flip back. She's going to bring the slides back up for you and move forward. I want to talk about, and this has of late been of high interest to everyone. The state has put a lot of work in, and most people don't realize the process that it goes through to have a service become a Medicaid reimbursable service. It's not just something where you turn on a switch and all of a sudden do it. So there's a lot of things going on. And in 2019, Senate Concurrent Resolution SCR 84 was passed. And that resolution basically required LDH to take all the necessary steps to assure that peer support services would be covered as a Medicaid billable service. So that is what really started pushing this forward. Our state fiscal year, which we are in right now, included in that budget, and a lot of publicity didn't come from that because of the way the budget in this last session was kind of formulated with the social distancing and COVID going on. But there were dollars included in the budget for the match. We have to do when we have Medicaid reimbursable services. There is a state match that goes along with the federal portion of it. So those dollars had to allocated and passed through our budget process. So that was accomplished. So those dollars are there for that. So the next steps, and this is where I get a lot of calls. We get lots of emails. Everyone wants to know what's next. The first thing is, as a matter of fact, yesterday it hit the website, the state's website, there's a request or an RFI for peer training and certification that's out there. And as the state is preparing for this expansion and the infrastructure, feedback is needed and sought from partners and stakeholders on that, on the education process, on the credentialing process, on the total process. That RFI can be found, and I've attached the link in the PowerPoint at ldh.la.gov/index.cfm/page/2578. So it's there, and this information will be available. You can find it. Please note that the comments have to be in by midnight on September 13th. And next Tuesday, there will be a virtual question and answer session. That information, again, is attached to this. So if you follow this link, I encourage you to click on the links. There's multiple links there. Read the information because there's a lot of good information, not only on peer support, but on the virtual question and answering, on the RFI. So literally everything you need to know at this point is there for you to be able to be active and interact with that. Also, the Office of Behavioral Health, the state is going to have to go through the rulemaking process. It's required by CMS to add peer support services as a Medicaid reimbursable services. Part of this process will include the release of the service definition for public review and comment. So again, a lot of people have asked, is there a service definition? What that reimbursable rate would be? Is it going to be in 15-minute sections? All those different questions will be answered. This is a process that we're going through. I don't have all that information to comment on because some of that stuff is still being worked on and worked through. It's a process, but know that that process is happening and that process is moving forward, and there's a lot of work being done in that. Now, some goals to consider one, implement peer support services as a Medicaid reimbursable services. And the goal to do that is in early 2021. And it's going to be a phased implementation approach to do that. And the way that the state's going to move forward with that is the initial implementation will be done proposed through the 10 LGEs or the local governing entities. Now, I know as a private agency, a private provider, my first thought with that said, whoa, why are they doing it that way? Well, I've been around long enough to go through privatization, Medicaid expansion, all the different things. So this gives the state and everyone an opportunity to clearly work out any problems, really get it on a firm footing. So when usually things are rolled out, there's confusion, you gotta wait to get paid, a lot of different things. The plan is to, again, work it through the local governing entities. They have a great working relationship because they are technically part of, and so that will be established in the beginning of 2021. Now, how long that process takes, it depends on a lot of different factors. It is just seeing how the implementation, how the documentation, how everything is going, and then there will be a staged rollout to the providers to be able to also bill for and be reimbursed for peer support services. Now, the state is looking to establish entities to provide state-approved peer support specialist training in various areas throughout the state and to increase the trainings and infrastructure to meet that growing demand. I can tell you this, just this amount of applications that we have been receiving lately, it exceeds the training capacity currently because of the COVID restrictions on how many people we can train per session and that. We are working to expand that. There was a request for applications for more peer support trainers. That process is done. There's actually been some finalists for interviews selected in that process. So we're taking steps to roll out more trainings and to roll out more things, but this is to take this even further than that, because if it grows according to goal, this will most definitely outgrow our agency's ability to do all those things. and that we will continue to like to be involved in the training process, but at some things it will involve multiple entities to do that. There's also is then to identify who that accreditation body is, who will keep track of the CEUs and the ongoing credentialing requirements. That's one of the things that is being looked at right now, because right now the Office of Behavioral Health has been taking on that task, which as this thing grows, will grow beyond what they want their capacity to be in this process too. Remember, they are a monitoring agency and ensuring things will go well, not the actual provider of. And they've been the provider of in this process. So, and they've done a really good job of it. But again, as it grows, it will be something that there will be a decision to hand it off or develop, or to whatever that mechanism will be done in that going forward. Let me see, I'm not even sure where I am on my time in that, but I wanted to open this up for some questions that y'all might have as far as any of the material we've gone over, anything having to do with peer support, anything to do with the training, anything to do with what the next steps are and that. And to my ability to answer them, I will do my best to answer them. Remember, some of the things, all information is not known yet, but we will do that. Also, after we complete the question and answers, there's going to be some contact information that'll come up where for myself and also for Ricardo Williams, who is with the state, that's over the peer support programs, that you'll be able to interact with us through email. We can make sure you get information that was outlined in this PowerPoint. So please feel free to interact with us too as this process is going. But again, I'm going to open it up for questions. Ann is going to read me the question, and I may have to reread them or that, and we'll go from there. But I encourage you to ask questions.
So one thing, and I hope everybody can hear me, I'm trying to stay a little bit offline and socially distance appropriately. Please go ahead and, if you would, input your questions within the chat function. I have seen a lot of comments about individuals who are following this process. I'm going to get a little bit on screen. I've got my arm here. I see that people are following the process somewhat. They're really interested, it looks like, in the RFI that we have coming out. Lots of good jobs. This is interesting. There was one question that I have seen so far, and it's what kinds of assessments are peer support specialists qualified to perform? And I'll go ahead and answer that. It feels like a little bit more of kind of a state response. And what I will say is this, is that the types of assessments that individuals are able to do, perform, would always fall within their scope of practice, right? And so it really is going to depend on the particular position. It's going to depend on the particular program in which they're working under. I don't know if Brent would have any kind of knowledge or experience about that in conjunction with the grant programs that he's working within, and what kind of assessments individuals are doing, what kinds of screenings individuals are doing. But that will probably be one of those things that I'm confident will be refined, especially as these programs become more gelled and more formal and are ready for implementation. Britt, did you have any feedback regarding that particular piece?
Well, so peers do things like pre-screenings, which are essentially just ascertaining if someone is presenting in a way that would really strongly indicate they have a substance use or mental health challenge, and then we would refer them for a psychosocial workup. It's just a way of putting forward the best people to receive services rather than just anyone that we encounter.
Absolutely. And so just to kind of reiterate on that, as Brent did a fantastic job of discussing what the role of a peer support specialist is within our system, and George did a great job of explaining it as well. The role of the peer support specialist in Louisiana nationally is absolutely critical. And they play such a profound positive role within our system. At the same time, we all know that's kind of like that balance, right? And one of the things that Brent said is that historically peers have been underutilized, right? And they've been asked to do things that really don't have them fulfill their full capacity, right? Conversely, we also know that peers aren't necessarily always clinicians, right? And we also don't want them to provide that clinical role that would be outside of their scope. And so making sure that peers, we have a very clear and clearly defined function, and that we are asking individuals to perform functions that are appropriate with their scope of practice as a peer support specialist here in Louisiana.
Can I add one other little thing to that?
Absolutely.
One thing, and again, I've been involved at an administrative level for over 25 years in different behavioral health settings and stuff. Peers are very good too at gathering information on the front end in that, because there's a lot of times the individual will feel more comfortable talking with them on the front end. And when they first come in, that's why one of the comments was they're utilized sometimes in the lobbies and up front to greet and that, but even taking more of that of just talking to and being able to get information, because a lot of times there's an initial trust level. Now they can't do, quote, any kind of diagnostic information or, you know, assessing for levels of care or anything like that, but they can gather information and they can get those and really make the people more at ease within that next step where they are actually getting their clinical assessments and meeting with clinical professionals to open that up for them. So it works, kind of breaks the ice, I guess is a good way of putting it. It puts them more comfortable and more at ease. So it's, again, it's however you're set up clinically and how your intake process or that is done. But again, I encourage you to consider the use of peer support specialists in that process of gathering that information and gathering those things you need as the individuals come in.
So we've received another question.
Okay.
Does the OBH training include any of the evidence-based practices for peer support specialists, such as WHAM, whole health action management, or any other activities?
That I don't know.
Well, so what I will go ahead and say, if I could as well. So the Office of Behavioral Health has historically worked with individuals on a variety of different trainings. We do have supported RAP, Wellness Recovery Action Plans for individuals. I don't know that we've had a training on that recently. I know that it is something that we have
scheduled this year.
We will have scheduled this year, as George indicated. We also do have a program that is affiliated through Mental Health Association of Greater Baton Rouge, and they have a whole health action management like program called Target Health that we do have implemented throughout the state, and they offer that program statewide. We can certainly get you in touch with Ricardo Williams. His contact information, I believe, is on the next slide, George. And you can get with Ricardo, and Ricardo can provide you with additional information about that specific training and get you in touch with that organization who could give you more information. Are there any other questions?
Are there some in the chat?
That's what I'm looking at the chat. Oh, there are a couple more questions, excuse me.
Okay.
So there is one question: will there be state positions offered at the LGE level? I'm not sure of the answer to.
I can help just a little bit with that. Yeah, and I can tell you this. One of the contracts we have with our local governing entity is we provide peer support specialists through a contract. It is my anticipation, and we've been trying to grow that. This year we've been able to add some more hours in that for the use in the district and for the drop-in center that we have in Lafayette. It is hoped, depending on, of course, budgeting and depending on, again, the rollout of Medicaid, it is our anticipation that there will probably be more positions added because one, with the tight budgets, they'll have money through Medicaid to help reimburse for some of those costs and stuff. And I think the districts as a whole are really buying in to the use of peer support specialists. They're seeing the advantage and the good things of having them. So although I can't speak for them, it is my anticipation that there are going to be additional positions within the districts for peer support because of things that are happening going forward.
And if I could just go ahead and expound on that, I would expect with all of the systems change that we have implemented in Louisiana, that we will expect to see a lot of positions coming about throughout our entire system, right? So that's one of the reasons that we have the request for information out, that we're looking at ways in which we can really enhance and improve our training system as well as our credentialing process for peer support specialists statewide. It's one of the reasons we're looking at different ways in which we can have the trainings conducted, because we're looking at the future, and we're looking at all of the different services that we're really wanting to make sure that we have peers embedded in, that we want to make sure that conversely, we have a system that's truly equipped to be able to manage the influx of peers working within our system, but they're also able to monitor and manage that credentialing system to ensure that peers are keeping up with their CEUs, making sure that they're maintaining their ethics requirements, and making sure that we really have peers operating within our system in a way that really would best fit our system. And so we're trying to make sure that we're readying the field so that we can have peers working everywhere, working within our system.
And remember too, peers cross a couple different lines because it's not all addiction, it's not all mental health. So you have a couple areas that they're operating within.
There was one other question that came through, George, and I'll go ahead and speak to this as well, because it was specifically asking about a particular entity being considered as an accreditation body. And that is pretty premature to be able to do that. We're not able to speak to whether or not any specific entity is able to work as an accreditation body. We're trying to go through this process, taking one step at a time and making sure that we're moving forward in a fashion that is appropriate for our system. That first step is that RFI, that request for information. And so as George had indicated earlier, please go to the link that is provided within the PowerPoint presentation. It's within the OBH webpage related to peer support specialists. So I'm working under the assumption that most of you who are familiar with or participating today are familiar with that site, because it includes all of the information that we have related to peer support programming in Louisiana and the trainings, etc. That site will take you to a link to the RFI itself, as well as the addendum, the additional documents that we have attached to that RFI to help really paint a picture about peer support and what we're looking for here in Louisiana. It gives information regarding the deadline that George had relayed. It also gives information related to that question and answer session. So I would encourage you to go to that RFI, fill out the RFI, participate in the question and answer session. Once we've obtained that information and we're moving through with this process, then we will be going through a process of potentially completing a request for purchase, right? An RFP process through which we would be having an individual or entity come on board. And so that is actually somewhat premature to say, because we're not sure where we're going to land with all of that. We need to get through this first step of this RFI process initially. But please, I'm so excited that individuals are expressing the interest. They want to know more. They want to do more. And so please, please, please do participate in our RFI process, because your feedback is certainly valuable.
Yes, and please feel free to share that information with others too. Because of course, the Office of Behavioral Health would like to have as much participation as possible in that process.
There is another question. Okay. Where can we find a list of accepted CEUs for current RI International certifications?
That we will try to, I will get with Ricardo and see if it's possible to post any kind of list for that. I don't know that there's an exact list available at the moment for that, but I will get with him and see if we can get that posted, possibly on the peer support section of the OBH page. So we will look into that, and we will respond to that as soon as we can. Okay.
And one other thing I would also just reiterate, I'm going to stay off visual right now, that I do know that one of the things that Ricardo does try to do with regularity, and he does do with regularity, is send out notifications of CEU opportunities as they come up. I'm a licensed clinical social worker, and I know that, you know, it is very helpful to have a place to go to be able to look for resources. But I also know that that's an evolving list, right? And so I become aware of training opportunities via email, via different listservs. And so if you are not on Ricardo's listserv, please look to get on that. I believe, George, you had included a link, email link.
We have that contact information on the next slide when we're done with the question and answers.
Okay, great.
Anyone else?
Let me see. I am not seeing any other questions. If there's any other questions, please send them through.
Okay, why don't we go ahead and post that last slide?
There is actually another. There's another question. Is there an active campaign to educate all stakeholders in the wider behavioral health service community? I'm not sure. I'm not understanding necessarily the context of that ask. Oh, on the definition of peers. Thank you for that clarification. So, George, do you want to?
Well, I'm not going to say that there's a campaign going on or anything. What we're attempting to do is, again, through avenues such as this. We had another scheduled speaking engagement earlier that was canceled because of the COVID and put off. So we're going to be more actively in the community, doing more stuff on the internet, doing things to communicate information out to treatment providers, and the public in this going forward. But is there a specific, quote, campaign to do that that's been established? Not yet, not at this time.
And what I will say as well is, as we move forward with implementing Medicaid reimbursable peer support services, one of the things that seems like is a good fit for that is making sure that our system is really clear about what that service looks like. And so I would anticipate that you're going to see more and more activities coming up in the near future as these programs become implemented.
Now, one thing you can do in the meantime is, if you'll bring up this next slide, and if you can see that, first of all, the OBH PSS email listserv, that if you go to that and enter your information, you will be contacted as things comes up. My contact information is also up there, that we send out notifications on stuff. We also have our website and the state website. And then Ricardo, who is the OBH Peer Services Consumer Affairs Coordinator, his contact information is on there too. So between the three contact informations, if you will reach out to each of those and get your information, and you will be kept abreast going forward, training dates, new information, things. We will keep you informed through all the processes.
George, we have had a couple other questions, a question and a comment that I'll read out. So the first question is there someone an agency can contact to ask if certain tasks are within a peer support specialist scope of practice?
They would be able to, well, they could contact either Ricardo Williams or myself for right now.
Okay, great. And that
So
contact information.
The contact information is there.
The next is more of a comment, and it is from Laura. Laura, I'm going to slaughter the pronunciation of your last name. I should know this. Laura Lanier, I believe. For target health groups facilitated by peers, please email Laura Lanier, CPSS contact LLANIER@MHAGBR.com at the Mental Health Association, and she's indicating that a small stipend is available for participating in that.
Great.
Let me see if there's any more questions. We still have time that we can certainly try to answer those today.
I think we have about 5 more minutes, maybe.
We do. We have. So would you consider asking for volunteer peers to assist in educating the wider community about what a peer is and the benefits? That feels like a state question.
Yes.
And so I'm going to go ahead and answer that. And so what I would say is we'll have to see. You know, there's still a lot going on with this program, and there is a lot being built. And we want to make sure that whatever communication is occurring, that it is coordinated, structured, and planful communication. Especially if there's anything coming out from the state, we need to make sure that it is very structured and we do not end up inadvertently creating confusion through mixed and crossed messaging. So, you know, that's one of those things that will be to be determined as we work through this process and we make sure that we know how this ship is being built. We don't want to take off before it gets out of the dock, right? We want to make sure that we have a very planful process ahead of us, and that's why we need to take one step at a time, and we're doing this RFI process. But any messaging at this point related to this program will need to come through the state and our particular processes again, because what we do not want to do is we do not want to end up with a situation in which there is mass confusion about the direction of where this program and its services are going, because we've got too many individuals who are out there messaging, especially if there's the possibility of not having the exact same message that's going out there.
And again, I'll just add on that again, utilize this contact information. That is the state's information as providing for peer support, and my company's information as the approved training entity right at this point.
Absolutely.
And I can assure you that myself and OBH communicate really well and very regularly.
We do. We communicate very regularly. And again, to reiterate, the reason for that is because we want to make sure that we have that consistent, clear message that's going out to everybody regarding programming, right?
Yes.
So, and I'm just monitoring for the last few minutes to see if there's any additional questions that are coming out. There is another comment. There is a volunteer group now, was Cheers for Peers, now is LAPAC, LAPAAC, Louisiana Peer Advocacy Action Committee, working with OBH. Please let Laura Lanier know. Again, that email is LLANIER@MHAGBR.com.
And we also have Laura's contact information.
Oh, fantastic. I'm not seeing any other questions coming through. So with that, we might just end 5 minutes early. But I appreciate it. I appreciate you, George, for taking the time to present with us
thank you.
today. And I appreciate you, Brent. You always have such a compelling story that you tell, and it's really not that we need any inspiration or motivation to have peers working with our system. It certainly is something that we are committed to as a state. But I appreciate all of you for the work that you're doing. So I'm sorry, I'm just seeing another comment in here that says Zoom meeting for peers for after conference breakdown and action items. Friday at 5:30 info in AP under meetups. Okay, so anyway, well, so thank you all so much for all that you do, and I am excited about the movement that peer support is undertaking in Louisiana, and I'm very excited about the collaborations that we have underway. Thank you so much.